Welcome everyone to today's video, where we'll be showcasing the transformation journeys of our patients. So, let's begin with the journeys of our first two patients and see how their hair transplant results transformed their appearance and boosted their confidence.
When hair loss reaches an advanced stage, one question naturally arises. Is it still possible to achieve real, visible results? Today, we bring you not one, but two truly inspiring hair transformation stories that stand as powerful examples of courage, patience, and complete transformation. These journeys prove that even at advanced stages, the right approach can restore more than just hair. It can restore confidence. If you are ready to transform your look and regain your confidence, then visit QHT Clinic, which is now in Haridwar, Delhi, Gurugram, and Hyderabad. Book your consultation today and take the first step toward your own stunning transformation. Let us move on to the pre-treatment conditions of both patients, where our experts carefully analyzed and identified the extent of their baldness. Patient 1 was experiencing diffuse grade 5A baldness. His hairline had significantly receded, and the side areas had become extremely thin. Only a few follicles were visible in the frontal tuft region. His frontal area was almost completely damaged, and the mid-scalp had undergone severe thinning, which greatly affected his overall facial balance. Fortunately, his donor area was strong and healthy. This played a crucial role in the success of his procedure, as it allowed for precise graft extraction and strategic placement. Because of this strong donor region, our experts were able to achieve dense, natural, and highly impressive results. Patient 2 was struggling with diffuse grade 6 baldness. His hairline had completely receded, and the frontal, mid-scalp, and crown areas were entirely damaged, which had a significant impact on his facial frame. Despite the advanced stage of hair loss, certain areas of the scalp still contained healthy hair follicles, providing a solid foundation for treatment. Once again, a strong and dense donor area proved to be the key advantage. These healthy grafts became the backbone of his transformation journey, contributing significantly to the final outcome. Both patients faced different grades of baldness, yet shared one powerful advantage: a strong donor area. This became the foundation of their remarkable transformations. Now let us move forward and see how our experts meticulously designed their perfect, natural-looking hairlines to restore confidence and facial balance. If you are facing similar hair problems, share your scalp pictures with our experts on the given helpline number. They will guide you on whether you need a hair transplant or a medication plan. Why is hairline design one of the most important steps in a hair transplant procedure? Hairline design plays a crucial role because it defines the overall facial appearance. A well-designed hairline restores not just hair, but facial balance, symmetry, and confidence. Even with excellent graft quality, an incorrect hairline can look unnatural. This is why hairline designing requires experience, precision, and a strong aesthetic sense. After a detailed examination of the complete scalp, our experts begin by trimming the hair and giving each patient a proper head wash. This helps remove dirt, excess oil, and dead skin cells, creating a clean and smooth surface for accurate and precise markings. While designing the hairline, our specialists carefully evaluate facial proportions, bone structure, and the level and pattern of baldness. For patient 1, our experts created a custom-shaped hairline tailored to his facial structure. The distance of the new hairline was carefully measured from the glabella point to ensure perfect facial symmetry. Along with the hairline, all remaining affected areas that required coverage were also clearly marked. For patient 2, the hairline was again measured from the glabella point. However, since he was suffering from diffuse grade 6 advanced stage of baldness, full scalp coverage was required. In his case, our experts first designed a customized hairline and then marked the frontal area, mid-scalp, and crown to ensure complete and balanced coverage. These markings were not simply lines drawn on the scalp. They served as the foundation of the entire procedure. They guided the surgical team, defined the recipient zones, and ensured that every graft was placed with accuracy, resulting in a natural, balanced, and aesthetically pleasing outcome from every angle. Want a perfectly natural hairline that suits your face? So book your appointment with our experts today and start your transformation. After completing the hairline designing, our experts move on to the next critical phase of the. Once the markings are finalized, the slit creation process begins, which is one of the most crucial steps in a hair transplant. Within the pre-marked recipient zones, our surgeons carefully create tiny, precise slits. These slits determine the exact direction, angle, depth, and density of each graft, playing a vital role in achieving a natural outcome. For both patients, an advanced zigzag technique was used in the hairline area to create a soft, natural, and seamless appearance. This step forms the true foundation of a successful hair transplant. After the slits were completed, our experts began the graft extraction and implantation process, carefully following the direction and angulation that were created earlier. Now let us understand the graft procedure for each patient, one by one. For patient 1, our experts implanted single and fine hair follicles in a natural zigzag pattern to create a soft and realistic hairline. This technique helped restore his complete facial frame and ensured a seamless transition between the hairline and existing hair. In the frontal and mid-scalp areas, double and triple hair follicles were implanted to achieve optimal volume and density. In total, 3,100 grafts were implanted, all carefully extracted from the safe donor zone, ensuring healthy and long-lasting results. Patient 2 presented with a more advanced stage of baldness compared to patient 1. To maintain a natural and soft appearance, our experts first implanted single and thin follicles in the hairline zone. Following this, double and triple follicles were implanted in the frontal and mid-scalp regions to enhance density and coverage. In the crown area, special attention was given to recreating the natural swirl pattern. Here, single, double, and triple hair follicles were implanted at varying angles to ensure a realistic and natural crown appearance. In this case, a total of 5,200 grafts were extracted from both the donor scalp and beard area, allowing for comprehensive coverage and balanced density. These transplanted follicles are naturally resistant to DHT, which helps ensure long-lasting, stable, and completely natural-looking results. 1 month after the transplant, the patient visited our clinic for his first follow-up PRP session. At this stage, our experts observed approximately 40% shedding, which is a completely normal and expected phase of the hair transplant process. At the same time, the donor area was fully healed, with no visible signs of discomfort or damage, as clearly seen on the scalp. Three months after the transplant, the patient had completely passed the shedding phase. The hairline had begun to take on a natural shape, while the native hair continued to grow normally alongside the transplanted hair. The donor area was fully healed, with no visible signs of extraction. Overall, this stage clearly indicated a smooth, healthy, and successful recovery, setting the foundation for excellent upcoming results. 9 months after the transplant, Patient 1 achieved remarkable and life-changing results. When compared to his pre-transplant condition, the transformation is clearly visible. His hairline now forms a sharp yet natural frame for the face, while the frontal and mid-scalp areas display impressive volume and density. Overall, his appearance has completely changed. The patient can now cut and style his hair freely according to his preference, and the transplanted hair blends seamlessly with his natural hair, delivering results that look and feel completely natural. You can begin your own hair restoration journey by simply giving us a call or sharing your pictures with us. Our specialists will carefully assess your condition and guide you toward the most suitable treatment option based on your individual needs. Now let's move on to the follow-ups and results of patient 2. But we look at the follow-up photographs, that the patient personally shared with us after the surgery. These images are from day 1 through day 5, allowing you to clearly observe the step-by-step progress during the initial recovery phase and understand how the scalp heals in the early days after the transplant. 1 month after the hair transplant, approximately 60% shedding was visible on the scalp. This is a completely normal and expected phase of the hair transplant process. At the same time, the patient's native hair had already begun to grow. Six months after the transplant, the improvement in patient 2's scalp was clearly visible. His hairline had begun to take a perfect shape, beautifully framing his face and enhancing his overall appearance. Visible growth was observed in the frontal and mid-scalp areas, where the native hair had started merging seamlessly with the transplanted follicles, as clearly seen on the scalp. Even though this was only the 6-month milestone, the results were already quite impressive, and the patient was clearly on track for an even better transformation ahead. Eight months after the transplant, the patient achieved complete and mature results, which are scientifically considered the ideal time frame for full hair transplant transformation. When comparing his before and after conditions, the difference is dramatic and highly noticeable. His hairline is now perfectly framed. The frontal and mid-scalp areas have gained excellent volume and density, and the crown area has achieved a natural swirl pattern. As a result, the patient's overall appearance has completely transformed, which is clearly visible on his scalp. At this stage, the patient can cut, style, and manage his hair freely, exactly the way he desires, just like natural hair. If you're also facing similar challenges, then right now, share your scalp picture with our experts, and they'll guide you on what works best for you. Can a hair transplant give results even in advanced baldness? Yes. Even in advanced stages of hair loss, visible and natural results are possible if the donor area is strong and the procedure is planned correctly. Customized hairline design, proper graft distribution, and advanced techniques play a crucial role in achieving successful outcomes. 2. What is diffuse baldness, and how is it different from regular hair loss? Diffuse baldness involves thinning across the scalp rather than complete bald patches. Hair follicles are present but weakened. With proper evaluation, many diffuse cases can be successfully treated using hair transplantation or a combination of medical therapies. 3. Why is a strong donor area so important for a hair transplant? The donor area provides healthy, DHT-resistant hair follicles. A strong donor region allows for safe graft extraction and strategic implantation, which directly impacts density, coverage, and long-term results. 4. What is slit creation, and why is it important? Slit creation involves making tiny incisions in the recipient area where grafts will be placed. These slits determine the direction, angle, depth, and density of hair growth, making this step essential for achieving natural and long-lasting results. This was the complete transformation of our 2 patients. We hope you found their journeys inspiring, because turning a bald look into a bold look is never easy. It requires expert planning, advanced technology, and most importantly, the patient's trust. If you also want to transform your appearance completely, don't wait. Book your consultation with our experts today and begin your journey towards a new, confident you.
just seen the transformation journeys of our first two patients. Now, let's move on to our next patient and take a look at their hair transplant journey. Have you ever caught yourself hiding behind a cap on outings, in photos, or even while meeting friends just because your hair doesn't feel like you anymore? Meet our patients who faced the same challenge for years. Patient 1, dealing with Norwood grade 2 baldness for nearly 4 years, discovered us on social media. Daily hair fall while combing and the constant need to wear a cap made socializing uncomfortable. Inspired by our YouTube results, he took the step, and in just 7 months, his look and confidence completely transformed. Patient 2, a video creator facing Norwood grade 3 baldness for over 5 years, felt his receding hairline was making him look older on camera. Caps became a necessity. After seeing our real patient results online, he chose QHT, and within 10 months, his overall look has changed. If you also want to achieve similar results than right now, book a consultation with our experts. In this video, we shared their complete hair transplant journey, from planning and hairline design to progressive hair growth. Watch till the end, and don't forget to subscribe for more real transformations and expert insights. Patient 1, who had an early stage baldness, primarily marked by a receding hairline. Over time, the position of his hairline had shifted backward from the frontal area, causing an imbalance in his overall facial frame and making the forehead appear broader. The recession had also progressed from the temporal sides, which made the frontal region look sparse from the corners. However, the remaining scalp maintained healthy and uniform hair growth, which meant there was no need for any surgical intervention in those areas. Most importantly, the donor area was healthy and dense, an essential factor for achieving natural and successful hair transplant results. In patient 2's case, the hairline had receded significantly toward the mid-scalp, making the forehead appear noticeably wider. The frontal area had become completely sparse, and this mid-stage baldness had a visible impact on his facial proportions. As a result, his overall appearance began to look dull and aged, and styling his hair became increasingly difficult. Being a content creator, appearance played a crucial role in his professional life. The positive aspect was that the remaining scalp still had healthy hair growth, eliminating the need for any surgical intervention beyond the frontal region. The primary requirement was to restore the frontal hairline and density, which was well supported by his healthy and dense donor area. If your hairline is also receding, you can simply share your pictures with us. Our doctors will help you understand your current stage and guide you towards the best treatment option. Once the detailed scalp assessment was completed, our experts moved on to the next step, which is hairline design. A well-planned hairline is the foundation of natural-looking results, as it directly impacts facial balance and overall appearance. To begin this process, both patients' heads were carefully shaved to clearly visualize the extent and pattern of baldness. The scalp was then thoroughly cleansed using a medicated solution to ensure proper hygiene and prepare the area for precise planning. After this, the hairline was designed. For patient 1, the hairline was planned by keeping his facial proportions in mind and accurately measuring the distance from the glabella point. Along with this, the frontal area was carefully outlined and the temporal angles were precisely marked to restore a well-defined hairline. Since the remaining scalp showed healthy and dense hair growth, no additional markings were required in those areas. For patient 2, the hairline design was approached with equal precision but tailored to his round face shape and facial symmetry. Measurements from the glabella point helped create a soft, natural hairline that complemented his facial structure. Along with this, the affected frontal area was outlined and the small patchy area with absent follicles was also marked separately. These detailed markings provided the surgeons with a clear roadmap of the bald areas and served as essential guidelines during surgery, ensuring accurate graft placement and optimal density. After finalizing the hairline design, our team immediately began the surgical procedure. First, we then administered local anesthesia to ensure the procedure remained completely painless and comfortable throughout. Once the anesthesia took effect, our experts created micro slits in the affected areas of the scalp. They designed each slit with precision, carefully following the patient's natural hair growth, direction, angle, and depth. This step plays a critical role in achieving natural-looking results. Next, our surgeons performed extraction and implantation simultaneously using the advanced QHT technique. This method helps preserve follicle vitality, reduce graft out-of-body time, and significantly improve graft survival. For patient 1, our team implanted single and thin hair follicles in the hairline zone to create a soft and natural appearance. To enhance density and provide a fuller look, they strategically implanted double and triple hair follicles in the frontal area. In this case, a total of 2,510 follicles were implanted. all precisely extracted from the patient's safe donor zone without compromising donor density. For patient 2, the team followed a customized approach. They implanted single and thin hair follicles along the hairline to form a smooth, rounded contour that suited his round face shape. To restore balance and volume in the frontal region, they implanted double and triple hair follicles for optimal density. In this case, the surgeons transplanted 3,200 follicles, carefully extracted from the safe donor zone while maintaining long-term donor area integrity. Our team executed every step with precision, expertise, and advanced planning to deliver dense, natural, and long-lasting hair transplant results for both patients. If you want to know more about the procedure, comment hair transplant. After the transplant, both patients visited the clinic multiple times for follow-up sessions. During these visits, our experts closely monitored the healing of the scalp and carefully assessed how the transplanted grafts were responding, ensuring proper recovery and optimal hair growth. At the 1-month follow-up, our experts observed nearly 70% shedding on patient 1's scalp. This shedding indicates that the transplanted follicles have successfully settled into the scalp and entered the resting phase. This stage is essential as it prepares the follicles for stronger and healthier regrowth in the upcoming growth cycle. During this phase, the patient's native hair continued to grow at its natural pace without any disturbance. The donor area showed excellent healing, with the skin fully recovered. Overall, the scalp condition remained healthy, confirming proper graft survival and a smooth post-transplant recovery process. 2 months after the transplant, patient 2 visited the clinic for his first follow-up. During this visit, our experts observed nearly 90% shedding in the transplanted area with mild redness present there, which naturally fades over time as healing progresses. At this stage, the transplanted follicles had successfully entered the resting phase, allowing the roots to strengthen beneath the scalp in preparation for healthy regrowth in the coming months. The patient's native hair follicles continued to grow at their natural pace without any disruption. The donor area has also healed completely without any inflammation. During the first and second month follow-up visits, both patients underwent their first PRP therapy session as part of their post-transplant care plan. This therapy plays a crucial role in stimulating the transplanted and native hair follicles by improving blood circulation to the scalp. Enhanced blood flow helps deliver essential nutrients and growth factors to the follicles, strengthens the roots, and supports faster healing and healthier hair regrowth. If you have any questions regarding the shedding phase or PRP, then drop them in the comments section. Our experts will guide you. 5 months after the transplant, both patient 1 and patient 2 visited the clinic for their next follow-up. During this visit, our experts observed that the shedding phase had fully concluded and the transplanted follicles had successfully transitioned into the active growth phase. At this stage, new hair growth appeared stronger and more mature. The hairline had started taking a well-defined shape, beautifully framing their facial features and restoring overall facial balance. In the frontal area, dense and voluminous hair growth was clearly visible, blending seamlessly with the patient's natural hair and creating a uniform, natural look across the scalp. The overall scalp showed consistent and even hair growth, which significantly enhanced their appearance and confidence. The donor areas had healed completely and became virtually undetectable, with no visible signs of extraction. For both patients, the progress at the 5-month mark appeared remarkably similar, reflecting healthy follicle survival, proper growth direction, and a successful transplant outcome. If you are also ready to bring back your hairline and are looking for the best clinic, then right now, book a consultation with our experts. 7 months after the transplant, patient 1 shared his fully matured hair growth progress. At this stage, the hairline had settled perfectly and now framed his facial features in a natural and balanced way, giving him a noticeably younger and more energetic appearance. The frontal area showed dense and voluminous hair growth, creating a strong and well-defined look that blended seamlessly with his native hair. The overall scalp appeared full and healthy, with uniform hair growth and improved texture. With the restoration complete, patient 1 can now style his hair freely and choose any haircut according to his preference, further enhancing his overall appearance and confidence. 8 months after the transplant, patient 2 confidently went for his first haircut of choice, marking a significant milestone in his hair restoration journey. By this stage, the transplanted hair had grown to sufficient length and strength, allowing him to style his hair freely. The texture and thickness of the hair had improved noticeably, and the overall growth blended naturally with his existing hair, clear proof that the follicles had matured successfully. At the 10-month mark, patient 2 visited the clinic for his scheduled PRP session. This time, he walked in with a completely new hairstyle, reflecting both his restored hairline and renewed confidence. The hairline appeared perfectly defined, soft, and natural, providing excellent facial framing and enhancing his overall appearance. The frontal area showed impressive density and volume, while the rest of the scalp appeared fuller and evenly covered. The hair growth looked healthy, strong, and well settled, with no visible gaps or patchiness. This stage highlighted a balanced combination of natural hair direction, proper density, and long-term graft survival, showcasing a successful transformation for patient 2. Patient 1 initially had early-stage baldness with a receding hairline that disrupted his facial balance and made the forehead appear broader. 7 months after the transplant, his hairline became well-defined and natural. The frontal area gained dense growth, and his overall appearance looked younger, fuller, and more confident. Patient 2 initially had mid-stage baldness with a significantly receded hairline and sparse frontal area, making his forehead appear wider and his look aged. 10 months after the transplant, his hairline became perfectly defined. The frontal area gained strong density, and his overall appearance looked fuller, balanced, and youthful. Both patients achieved highly impressive results despite starting at different stages of baldness. In both cases, the hairlines appeared natural and well-defined. The frontal areas gained excellent density, and the transplanted hair blended seamlessly with the native hair. At the 7 and 10 month marks, both achieved outstanding results that will continue to improve naturally for a lifetime. If you also want the impressive results with painless surgery experience, then right now, book your slot. Give a call or drop a message, our team will reach you out. Or visit any of our branch.
मॉडल कॉलोनी हरिद्वार, D15, आउटर रिंग रोड, प्रशांत विहार, सेक्टर 14, रोहिणी, दिल्ली। नर्सिंग होम प्लॉट संख्या 3, सेक्टर 46, गुरुग्राम, हरियाणा। ऑपोजिट होटल पार्क हयात, रोड नंबर 2, बंजारा हिल्स, हैदराबाद, तेलंगाना।
हेलो फ्रेंड्स, अगर आपने अभी तक हमारे चैनल को सब्सक्राइब नहीं किया है तो प्लीज इस वीडियो को लाइक कीजिए, शेयर कीजिए और हमारे चैनल को सब्सक्राइब कीजिए। और ध्यान रहे बेल आइकन दबाना ना भूलें, जिससे हमारे हर वीडियो का अपडेट आपको समय समय पर मिलता रहेगा।